Hello and welcome to the program Newsroom series, this edition covering Nigeria's southeast. I am Bukola Koka, and we start in Enugu State, where the government and the Commonwealth Enterprise and Investment Council have signed a strategic partnership agreement that would accelerate trade and investment flow to the state. Speaking during the partnership signing ceremony at the Government House in Enugu, the leader of the delegation and Chief Executive Officer of the organization, Rosie Glazebrook, expressed the organization's eagerness to support the investment drive of Governor Mba's administration. For Governor Mba, the strategic partnership with CWEG is in line with his administration's projection to grow Enugu State's economy exponentially from $4 billion to $30 billion.
I'm very excited to hear more about the Enugu New City, the school program, the Enugu Airlines, which I think comes on track next year, and of course the convention centre with the hotel, which we very much look forward to discussing and developing plans to bring many of our strategic partners here to Enugu so they can see for themselves what amazing progress is being made. And those are just some of the areas that I've mentioned. Clearly, there are many more. So our organisation is here to help you, the government of Enugu, show the outside world and the audience to the opportunities here. And we want to do our very best to support all those efforts.
The value of this strategic partnership cannot be lost on us because we see it as a platform that will enable us tapping, you have over 140 private sector partners. So whether it is partnership between government and business or between government and government, we see you as that channel that would give us access. So we're truly looking forward to the opportunity that this partnership brings. I have received your invitation, and I can tell you that it's truly an honor to be able to participate in your investment summit next year and to co-chair your governor's forum.
As part of activities to commemorate the Universal Health Coverage Day 2024, the Anambra State Health Insurance Agency, ASIA, has launched its Strategic Health Development Plan, a key initiative aimed at advancing universal health coverage in the state. Speaking during the event at the office in Awka, the managing director of the agency, Dr. Simeon Oyemechi, discloses that the plan outlines practical strategies to expand health insurance coverage, ensuring that more residents are enrolled in the scheme, which will help the state move closer to achieving universal health coverage at the subnational level.
The Anambra State Health Insurance Agency, ASIA, opened its doors on January 1st, 2019 for public enrollment to allow citizens access quality and affordable healthcare services in the state.
This message has gone down well with our people.
Since then, the enrollment figures have hit 223,916 active enrollees and counting.
We are really so glad for what you have done and what ASIA is doing in the state, and we want to enjoin everybody. Nobody can do it alone. The government cannot do it alone. We are all stakeholders in this. So let us try to see how we can make ASIA, with this beautiful plan, strategic. It's called strategic because it's actually strategic to the point to achieve the goal of this insurance agency.
The state government says it's living up to beat in line with the universal health coverage as prescribed by the United Nations.
The World Health Organization has put that out-of-pocket health expenditure when people want to seek quality health care shouldn't be anything beyond 30 to 40%. We have in the state, through the effort of Mr. Governor Professor Charles Chukwuma Soludo, CFR, today, that wherever you reside in Anambra State, to ensure the universality of health care, no woman should die because they do not have money to access quality antenatal and maternal delivery services.
This plan outlines practical strategies to expand and consolidate health insurance coverage to ensure that more residents are enrolled in the ASHA scheme.
If you look at the board, you see a kind of, this schema is speaking on the strategic framework, how the plan is designed. We have pillar 1 to pillar 5, and the pillar 1 is on improving organizational capacity and culture. And the second one is to promote good governance and accountability.
The chairman, State House Committee on Health, decries insufficient publicity of the state health insurance scheme. Hence, residents in remote areas of the state still pay huge sums to access health care.
A lot of our people are not informed about this program. And I want to tell you something. If you go to the hinterlands, people still pay 300,000, 400,000 for CS to deliver. In fact, my own relative was delivered of a baby just 2 days ago, and they paid 300,000. I'm like, we've been talking about health insurance. Are you not insured? This is something you can just pay 10%, and then it's even free now.
As all the relevant stakeholders join in unveiling the Anambra Strategic Health Development Plan, the state government is confident that its goal of achieving the universal health coverage at the state level is beginning to take shape, a significant step in the collective mission of the state government to improve healthcare access for all.
Us on the program to discuss more about Anambra State's health insurance scheme is the Managing Director of the Anambra State Health Insurance Agency, Dr. Simeon Onyemechi. Good afternoon and welcome to the program.
Good afternoon. Thank you so much.
Thank you, sir. So that report may just have, given us a cue as to where to start the conversation from, which would be access and what the coverage itself is worth, what it covers for the average applicant into the scheme. So I'd like you to walk us through that first before we talk about awareness.
Thank you so much. Anambra State Health Insurance Scheme have got a very robust benefit package that range from health promotion, health prevention, then we have curative care, and then rehabilitative care. Quite frankly, as far as it goes, common things occurring commonly in the primary services, we take care of any cause for which somebody who has got a febrile ailment, simple things, malaria, urinary tract infection, chest infections, pneumonia, and what have you. A woman who is still in child reproductive age, having need for maternal services like labor, antenatal, labor, delivery. Even if that delivery on the day of delivery ends up being cesarean section, whether planned or unplanned, that is covered in the scheme. We cover surgical conditions, appendectomy, hemiorrhaphy, even myomectomy for women who want to, who have need for fibroid operations. We cover hysterectomy if you want to remove the womb. We treat hypertension, diabetes. Most of these lifestyle modifiable diseases for which people die needlessly because they cannot afford the high cost of paying their buying their medications frequently. The state government in our health insurance scheme, we cover all of those people who have need for inpatient care. You need to be admitted for up to 25 days actually in a year. Anambra State Health Insurance Agency will pay for your hospital admission. We cover down to high-end investigation, magnetic resonance imaging, which we offer once in a year, CT scan twice in a year. When we started, the benefit package was quite lean. But over time, we, using the principle of progressive universalism, as we got more people registered in the scheme, and then more money for the scheme, with more funding, of course, from government, we gradually began to expand our benefit package to where we are today. So the fact that you can be in ASHA because you pay 12,000 naira and you are able to access services like prostatectomy for older men who want to have prostate surgeries done and what have you. just because you pay 12,000, because really,
And
ours is a social government trying to leave no one behind. And the beauty of the benefit package we have in Anambra State is that there is no cream skimming. We do not segregate against anybody. There's no pre-existing condition that will exclude you from the scheme. Whether you are known with hypertension, diabetes, all of those, we just give them. You have need for
and that's
care.
quite.
You can take your classes. Yeah.
And that's quite comprehensive. That's quite comprehensive. But that report also highlights the challenge of access. You know, talking about people in the remote areas not aware of the huge benefits of the scheme. So is the government considering awareness, particularly in the local languages, so that the people can understand that there's this huge benefit in the insurance scheme, and then they can, you know, take it up, apply?
Well, just to say that there are things that militate against access to healthcare and health insurance penetration overall. When you have the health insurance scheme, like in our own end, where we pay capitation and fee for service to healthcare providers, as and when there's no hospital we are indebted to on record. Today is 13th of December. We have paid the fee for service for those who went to hospitals last month, November 2024. All of the secondary and tertiary cases that they assessed, we have paid out because we have a fully digitalized system. Because in our own state, what the mantra of the governor is, Professor Charles Kuma Soludo, is that technology, everything, technology everywhere. So really we have used technology, leveraging on that to ensure that the facilities are paid on time, end to end. There's no paper use in our scheme completely. However, we now have that in the supply side, that is when you go to the healthcare provider end, there are places where the hospitals that we are using will really, but they are fewer in number, quite frankly, who will not treat these our beneficiaries very well. And you are already having a business, health insurance business, which is really running against factors like what I prefer to call not my portion syndrome. You are racing against our religious belief. Somebody tells you want me to register for health insurance because you're praying I should fall ill and all of that. Meanwhile, there's none of us who have got the badge. I'm a patient written on their foreheads. So quite frankly, there are several factors, the supply side factors, which is providers not doing so well, discouraging individuals from registering. But then if it's on the part of awareness creation, we have gone to churches, we do adverts, jingles all over, doing road shows and what have you. But then when we understood that the issues were sometimes that of supply side, that comes in what the governor, Professor Chukuma Charles Soludo, CFR, has started doing. In one fell swoop, he fixed 326 primary health centers, upgrading them to a point where we have access to services 24 hours, 7 days. Now, he recruited recently over 500 healthcare workers, including 42 medical doctors, 2 per local government, to ensure that we end the era of public facilities without doctors. Only yesterday night at the presidential villa, the PHC leadership challenge, Anambra State, Mr. Governor was there himself, emerged the best state in terms of improvement in our primary healthcare delivery system and health financing, for which Professor Chukuma Charles received the award yesterday, the plaque with an accompaniment of $1.2 million. But tracing what he has done. So he is deliberately trying to fix the supply side issues so that when our people go to facilities, then they will get value for this insurance. So those things that militated against people getting value for money, we are addressing them. And that is why in the last 2 years and 8 months of his administration, from where we were when he took over, we have added a whopping 98,000 new beneficiaries to our scheme, because the confidence of the people is being boosted, and our message of what we call adoption model, telling people to pay health insurance premium for those who cannot, is being received. And with technology, when you dial star 6700 star 005 hash, you can be on our mobile health insurance platform, and you can pay for yourself with
Dr.
any telephone device wherever you are. Thank you.
All right, Dr. Onyemaechi, we just may have to verify some of the things that you have said, the supply side, and indeed the efficacy of your awareness campaign, if there are still areas where the information has not covered. But indeed, we commend you for what you're doing, and thank you for your time on the program. We've been speaking with the director of the Anambra State Health Insurance Agency, Dr. Simeon Onyemaechi. Thank you for joining us.
Thank you so much. My pleasure.
The Abia State Governor, Dr. Alex Oti, has presented the 2025 budget proposal of 752,282,200,000 naira only to members of the State Assembly for consideration. Presenting the appropriation bill, Christian budget of sustained momentum, Dr. Oti says 82% of the budget is for capital expenditure, while 18% is for recurrent expenditure. The figure represents about 30% increase in the 2024 budget.
Many state governments are looking to start off the new year with renewed energy and vigor to deliver the dividends of democracy to the people, and they seek to do this through their spending plans for the year. In Abia State, House of Assembly legislators filled their chamber, eager to hear Governor Alex Oti's budget of sustained momentum, his second budget presentation since he was sworn in as governor on May 29, 2023. Before the governor reels out the figures, the Speaker of the Abia State House of Assembly, Emmanuel Emerua, reminds his colleagues that the state cannot function optimally, as he assures the governor that the Assembly will perform its constitutional role in ensuring a speedy passage of the budget once they have the figures to work with.
In 2025 is more aggressive, with 82% capital and 18% recurrent. You will see that the governor is taking the state further into development of our infrastructure and also to be ready for investors to come into Abia State to sustain our economy.
Right on cue, Governor Alex Oti unveils his budget, outlining each area in great detail, beginning with his accomplishments from the previous year.
Looking at the figures for 2024, we are raising the size of the proposed capital expenditure for 2025 by 29%, while the outlay for recurrent expenditure is raised by about 34%.
He then proposes that the budget value for 2025 be pegged at 750,282,200,000 naira only.
I hereby present for consideration of Mr. Speaker and the honorable members a total budget proposal of 750,282,200,000 naira only for the 2025 financial year. This figure represents about 30% increase in the 2024 figures and indicates that the scope of our progressive aspiration is high.
According to the governor, the draft of the 2025 budget has been comprehensively put together to capture the most important development priorities of the people, adding that the state government has not had cause to borrow so far.
As part of Operation Connect to Your Destination 2.0, the Federal Road Maintenance Agency, FERMA, has commenced repair on bad spots of federal roads in Ebonyi State. The program, launched by the Managing Director of FERMA, Mr. Emeka Agbasi, is designed to make the roads motorable during the Yuletide. The Federal Road Maintenance Agency has started repairing damaged sections of federal roads in Ebonyi. The road conditions have resulted in numerous accidents, causing loss of life and property damage. FERMA officials are on site to assess the situation and implement immediate repairs on the affected areas. According to the Federal Road Maintenance Engineer, Mr. Akinyemi Ojo, Operation Connect to Your Destination Phase 2 is currently underway in Ebonyi.
This is the season 2 of Operation Connect to Your Destination. The first season was last year, December, at this period. This is a program designed to make the road motorable during the Yuletide season, to make the roads free of accidents, free of potholes, to make it comfortable for the road user, especially during this Yuletide season, to reduce the travel time and to reduce the accidents on the road. if not to make it accident-free. And that's what we are doing in Ebonyi State now. This is happening all over the 36 states of the Federation, including the FCT.
In a bid to reduce rural poverty, increase food security, and stimulate economic growth, the Ebonyi State Governor, Mr. Francis Nwefuru, has flagged off the distribution of agricultural input and equipment for dry season farming. The distribution took place at IFAD office in Onwe Ebonyi in Izi local government area of the state.
Over 2,000 poor rural households involved in rice and cassava production and processing across 8 local government areas in Ebonyi State have gathered to participate in the distribution of agricultural inputs and equipment for dry season farming. Addressing the farmers at the event, the state governor, Francis Nwefuru, represented by his wife, Uzomaka Nwefuru, encouraged them to adopt modern agricultural practices using the provided equipment.
It is an investment in your potentials and a call to action. I encourage you to take full advantage of this opportunity, adopt modern agriculture practice, and collaborate to create value for your communities. Let us work together to make Ebonyi a hub for agriculture excellence.
State Chairman of the International Fund for Agricultural Development, Value Chain Development Program Steering Committee, announced that the state government has paid 200 million naira as a counterpart funding to IFAD as the state positions itself as Nigeria's agricultural hub. She encourages beneficiaries to use the equipment to improve their output.
And I want to advise farmers to utilize this equipment very well, because many of them will even set a tax for the people that will sell their own, because we really want Ebonyi State to be #1 in agriculture, to be #1 not only in the southeast, in Nigeria. Let us be the food basket of the nation. And with this equipment, I know we will do a lot, and Ebonyi State will be #1 in the area of agriculture.
Beneficiaries expressed gratitude to the state government for providing the agricultural input.
I can carry my goods to the market without wasting much time. I can even help others to carry their own. I can even be helping others. I can go some rural areas when vehicle cannot even reach.
The equipment is aimed at boosting food security, as Ebonyi State also aspires to become the food basket of the nation.
And as the Yuletide approaches, a women advocacy group in the Southeast under the aegis of Women of Honor Association has distributed palliatives worth millions of naira to indigent and vulnerable women and girls across the 27 local government areas of Imo State as a way of cushioning the effect of the current economic challenges in the country. And during the distribution of the palliatives, such as food items and cash donations at the Maria Azamta Catholic Church in Owerri, the state capital, founder and national coordinator of the group, Mrs. Shirley Okudimma, says the program is part of the association's outreach to uplift and empower communities in order to touch lives and ignite hope. She adds that the group remains committed to making a positive impact in communities by providing essential supplies to people who need assistance.
As we involve this outreach to uplift and empower our community, we are not just extending a hand, we are making a difference, touching lives and igniting hope. We are committed to making a positive impact on our community, one act of kindness at a time. From providing essential supplies to the people who need assistance to offering words of encouragement, we aim to touch the lives of those who need external support, mitigate the current economic situation of the country.
The Nigerian Navy has assured indigents of Imo State of adequate security and safety of life and property as they celebrate this Yuletide. The Commander Naval Base Oguta, Commodore Bashiru Salisu, disclosed this at the free medical outreach organized for members of the host community of the Oguta Naval Base in Eziosu, Oguta local government area of Imo State. According to the commander, who was represented by the executive officer, Naval Base Oguta Ukeme Anthony, the free medical outreach to members of the host community is in line with the vision of the Chief of Naval Staff to ensure a better civil-military relationship with host communities. Besides the free medical treatment, sanitary kits, treated mosquito nets, deodorants, writing materials and books were given to students of the Eziosu Community Secondary School.
In line with the mandate of the Nigerian Navy and the vision of the Chief of the Naval Staff, Vice Admiral Emmanuel Ikechukwu Ogala, this afternoon, Naval Base Oguta just organized and finished a medical and educational outreach for the good people of Eziosu Autonomous Community here in Imo State. This was aimed at fostering a better civil-military relations, enhancing and improving our corporate social responsibility, as well as improving our work relationship with the community. The people of Eziosu community and other host communities where the base is sited, they've welcomed these outreaches with a very good heart, because most of them had medical issues, and this was a very good opportunity for them to get treated, for them to get proper medical advice, and also for them to get a good medical checkup.
And this is where we drop the anchor on the program today. Thank you so much for watching. We'll be back again tomorrow. I am Bukola Koka. Bye for now.